Let's talk about informed consent for gabapentin. My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of the psychotropic medications and how I would go about an informed consent process for that. So today we're going to talk about gabapentin. In terms of psychiatric uses, it's often used to treat anxiety either as needed or scheduled, meaning you're taking it at the same time every day. It can also be used for alcohol withdrawal and cravings. Sometimes gabapentin can also be helpful for sleep. Now, it's probably not going to be prescribed purely for insomnia, but that may be an additional indication that it's prescribed for. You'll learn that basically gabapentin is a jack of all trades. It kind of does a lot of things a little bit, but nothing super well. So there's lots of medical indications for gabapentin as well. It was originally developed as an anti-epileptic or anti-seizure medication, and it also has uses for chronic pain, migraine, prophylaxis. So when I was in training, we handed out gabapentin like candy. You could say it was kind of the lesser evil compared to something like a benzodiazepine, which does have a lot of risks that we are aware of. However, as we have come to learn more about gabapentin, we've learned that it actually acts much closer to a benzodiazepine than we previously thought in terms of its potential adverse effects, long-term dependence, and things like that. So in terms of side effects that might initially occur, these could include things like drowsiness, lack of coordination, sometimes upset stomach, headache. Sometimes there can be a decrease in your mood or cognitive issues as well. But most commonly, people are going to experience a little bit of drowsiness. Your body tends to habituate to this medication pretty quickly, meaning that the side effects often go away within the first few doses. Longer term side effects are going to be primarily issues of withdrawal. So we previously thought that gabapentin was pretty easy to get off of. However, we've learned that it actually can be quite challenging to get off of, meaning that there can be significant dependence and withdrawal associated with trying to get off of the gabapentin. So an individual may need to take a long, slow, steady taper, just like they would with the benzodiazepine. We're also coming to realize that there is an increased risk of cognitive impairment with gabapentin. Its use is associated with the development of dementia. So of course, I would let the patient know all these things and ask if they had any questions. Now, although we don't have a ton of data on this yet, I would generally consider the risks of gabapentin in a similar way to benzodiazepines, meaning that if someone is taking it just occasionally as needed, the risks are much lower than taking it every day for a long period of time. So if I'm going to be presenting this to a patient, I'm probably going to be recommending the former. So always going to review the risks versus benefits and decide what's right for that patient depending on their individual situation. If there are other medications that you want me to do an informed consent process on, then please put them in the comments below. Wishing you all good mental health, and I'll see you in the next one.